talking to Dr. Derek Sherwood, who has said that he's oddly an ophthalmologist, but I don't know that the oddly counts. He has recently finished his role as chair of the CMC, the Council of Medical Colleges, and has been heading up the program about choosing wisely in New Zealand. So thanks for chatting to us, Derek.
It's a pleasure.
Yeah. So tell me about what you have been up to.
So with Choosing Wisely, I presume you mean. So Choosing Wisely is an international program that tries to reduce unnecessary testing and treatment in healthcare. It's been around since 2012. It started in the United States, but we've been facilitating introducing it into New Zealand for the last 2 or 3 years. So we've been working with health professional organisations like medical colleges and other health professional groups, working with DHBs, and then also trying to work with consumers and patients really to try and change attitudes about testing and treatment.
Oh, very good. I'm glad it was only 2012 that it came to New Zealand, because I sort of felt like, or was it the last couple of years?
No, it's only the last couple of years.
Oh, that's good, because I was thinking I might be behind the 8 ball. But with the introduction, and you're here at the College of GPs conference, so what are you thinking along the lines of talking to GPs and how we can be involved?
Well, I think that general practice is incredibly important, because actually for most people in the community, their main contact with the healthcare system is through general practice and primary care. And I think that what we're trying to achieve with Choosing Wisely is trying to really get better shared decision making with patients, trying to get patients asking more questions, giving them better information so they can make decisions that are right for them about both testing and treatment. So really primary care is essential. If we're going to get this change in culture and get patients being more involved in making decisions about their own healthcare, it's really got to start in primary care.
Yeah, I think many of my GP colleagues would probably say, well, I've got all these people who come in demanding tests of me, so what's the evidence behind it that we can have a little bit of backing to push back if we need to?
Yeah, well, I think so. Probably a couple of answers to that. Firstly, that's part of the reason we're trying to use a lot of media channels to get out to the community, that see if we can change attitudes in the community and bring about more understanding that there are risks to testing as well as benefits. The other thing I think is helpful, I think doctors often feel anxious about risk of complaint if they don't do a whole lot of tests. And I think that if we've got health professional organisations like colleges clearly backing doctors to be more reasonable and have more restraint about testing, that's going to be helpful and hopefully give doctors more confidence about saying no occasionally to patient requests.
So what are some of the examples that you've been using?
So, well, I guess the first thing is I always challenge any specialty group I talk to, including primary care, that they need to look at their own area of practice and identify, look at the evidence, look at the areas where they're doing unnecessary testing or treatment. There's some obvious examples, and the ones we all know about, antibiotics for viral upper respiratory tract infections, antibiotics for asymptomatic bacteria, and then if you look at other specialties, it might be surgical things like arthroscopies for degenerative knee disease, could be imaging, CT scanning for low back pain, or CT scanning for mild head injury where there's really no indication for imaging. So there's a lot of examples, but I think one of the important things is for each specialty to really look at their own practice, because I think there are very few areas of medicine where we don't have some problems with over-testing and over-treatment.
And so hopefully our future bodes well with trying to reduce what we do that is unnecessary. Is it, in the few years that it's been running in New Zealand, do you see a change in what's been going on?
I think it's probably a bit early to say, but evaluation of the impact is really important, and we're trying to look at a whole lot of different ways of evaluating the impact of what we're doing, because it's pointless doing it if we're not going to make a difference. A lot of this is about harm reduction rather than saving money. We're trying to emphasise doing right care for people and having better outcomes. So hopefully we're going to measure that and be able to say that we have made a difference.
Oh, very good. So I can actually refuse to have the whole body CT scan for my patients now?
Absolutely.
Awesome.
And in fact, we were talking today with Les Tooth about one of the lab companies was keen on introducing a system where patients could request their own labs, which we think is a terrible idea. We really feel that that's the role of the primary care doctor, is really to try and give some information and about risks and benefits and make sure that people are having the right tests that are going to benefit them.
Well, that's a daily conversation that I have, and hopefully I'll have more evidence later on so that I can back what I'm saying.
Fantastic.